Hello students, we'll discuss the instrument today. Let's see what this instrument is. See that it is in the anal canal. Some lesion is there, that was what we will discuss later. There's transparent, there's a groove here. It is getting retracted. So what is this instrument? It's a grooved proctoscope. So you got a proctoscope, traditional proctoscope of steel, which contains proctoscope proper with a obturator. So this is a grooved proctoscope, which is transparent also. It is used to visualize one part of the anal canal, so that other area is not visualized, so that you can focus and see what exactly it is. So, and if you want to do some procedure, it will be easier because other area is not will not come in your way. So that is why these grooved proctoscopes are very useful to identify specifically and do a procedure. So this is a grooved proctoscope, very typical. So findings here is there is a chronic fissure in with the fissure ulcer here. This is the fissure ulcer with the sentinel pile here. This is sentinel pile and hypertrophic papilla. There are three components for the fissure. All of you know: ulcer, sentinel pile, hypertrophic papilla. Proximal hypertrophic papilla, distal sentinel pile. This is the ulcer. So fissure you know that definition is it's a longitudinal ulcer in the lower anal canal. So it is a lower anal canal. It can be acute, it can be chronic. Acute causes severe spasm and severe pain, but no other component for that. It's usually treated by lateral sphincterotomy. Initially conservative by local application and drugs, anti-inflammatory, then eventually, if required, lateral sphincterotomy. A chronic fissure has got a component because of repeated fissure formation. They got a ulcer. There is a distal component called sentinel pile, guard, like a guard, skin component. Proximally, there is a hypertrophic papilla. The three components are there, and often it requires fissurectomy, of course, with the lateral sphincterotomy. So there are the two types actually. So this is the chronic fissure in with all typical, all three components. So this is the traditional proctoscope I just wanted to put. This is called Kelly's proctoscope. It has got outer tube, inner tube. Inner tube is blunt, outer tube is sharp. And with the inner tube, it should be passed in the lateral position. And direction after applying the jelly, do a rectal examination first. Then direction of the tube should be initially toward the umbilicus, then eventually upward. So go like this, then upward towards the umbilicus first, then upward like that. Once you fully push the tube inside, remove the obturator, then slowly withdraw the proctoscope under elimination. Visualize for piles, fissure, ulcers, growth, polyps, all those things. So mainly to visualize, you can take a biopsy also. Grooved proctoscopes, you can take a biopsy also. So it may be mainly it is for diagnostic purpose. Also there are few therapeutic uses also for this scope. So this is called Kelly's traditional proctoscope. This is the name. And so how to do proctoscope also important. Lateral position. Jelly should be applied. So this is the obturator. This is the obturator here. Obturator. This is the proctoscope proper. Like that. So that is the point which you have to remember always. So read my SRB's manual of surgery and clinical method of surgery about proctoscopy as such, and videos also there how to do proctoscopy in my book. And answer the MCQ students. Commonest complication of following hemorrhoidectomy is A, B, C, D. Put the right answer in your comment box. I acknowledge and appreciate your answer. Put the right answer later. Another MCQ: rectal prolapse is common in A, B, C, D. Put the right answer again, and I'll acknowledge your answer later. And quotation of the day is kind, short, easy words has got true, endless echoes. So easy words, kind words always give eventual reward later period. So be kind with everybody, be kind with the people, be kind with your work. So that is will give a lot, eventually long run it will be very, very useful. There is a quotation, especially for surgeons, it is useful. And students, please go through my YouTube channel, SRB Surgical Insight. Subscribe the channel, press the bell, and share with your friends and colleagues, and update your surgical knowledge about clinical cases daily, instruments, specimens, operative procedure, small complications, everything. For 8 to 10 minutes lecture daily will update your knowledge. It will help you learn surgery leisurely, interestingly actually. So please subscribe my YouTube channel and press the bell, share with your friends and colleagues. And students, I request you to have my manual of surgery, SR manual of surgery, current edition, with a lot of illustrations, photos, quotations, covers, oxy, everything, general surgery, GA surgeries, breast, thyroid, specialties, peripheral disease, venous diseases, parathyroid, adrenal, and differential diagnosis for mass abdomen, urology, cardiothoracic neurosurgery, and operative surgery, briefly instruments, specimen, operator briefly instrument, specimen, instruments, adjuvant therapy, anesthesia, all chapters are covered. Quotations are there with the principles, with the management policies, everything, with the staging for malignancies. Everything is covered as for a syllabus. And to understand, have your knowledge, use my SRB's manual surgery for your exam and to understand surgery as such. And also request to have my clinical methods in surgery, which contains examination of all chapters, general examination, hernia, hydrocele, breast, thyroid, peripheral disease, varicose veins, swelling, ulcer, abdomen examination, urology examination, specialty cases examination, briefly orthopedic, and with the instrument, specimen, and images. It will be very, but no management in this, but with the videos of all examination, hernia examination video, hydrocele video, breast examination, thyroid examination, and other things, and swelling examination, ulcer examination. So have my clinical method surgery to upgrade your clinical knowledge. It's the pillar of the surgery as such, because it contains videos, proper photos, and illustrations and clinical principles are there, and all differential diagnosis kept in the tabular form. It will be very, very useful for you. So have my clinical method surgery also, and through JP Publishers, and also purchase my DigiNow lectures of around 220 through JP Publishers, which covers everything: general surgery, clinical examination, and operative surgery, instrument, specimen, images. As for Oxy, all topics are covered. 220 lectures. Purchase these lectures for 1 year. It will be helpful to you to learn surgery before exam. Everything is covered. It will be useful. So please purchase my YouTube channel. You purchase my DigiNow lectures through JP Publishers. Have my SRB manual surgery. Have my clinical method surgery, and subscribe freely my YouTube channel SRB Surgical Insight to upgrade your surgical knowledge, and share with your friends and colleagues. Students, I hope you understood this lecture very well. Thank you so much.